therapeutic dose of platelets. The problem is that most PRP devices utilize either a single or a double spin method, which leaves behind all these extracellular vesicles in the PPP. So the reason is that standard PRP just doesn't spin fast enough. So my background is in molecular biology, and when we would want to work with exosomes, we'd have to use a piece of equipment called an ultracentrifuge. So that's the size of a washing machine. It spins at 100,000 RPMs, and we would drop our samples off at night and then pick them up in the morning. That's how low density these biomolecules are. But SuperShot solves this problem and eliminates the need for that piece of equipment. You can use your benchtop centrifuge, and the spin only takes 1 minute. So what is SuperShot? First of all, it's an FDA 510 cleared medical device. It allows you to do this 3-spin process so you can concentrate the autologous exosomes from your PPP. It works as a sizing mechanism, and it's made from 2 ingredients. They're just polyethylene glycol and dextran. These are very simple ingredients. They're polymers. They're found in everyday over-the-counter items. They're non-toxic, biologically inert. So SuperShot is a very safe product. The science behind it is it employs a physics mechanism called a 2-phase aqueous system. So we didn't create this physics mechanism, we just applied it to PRP processing. So you take a low-density polymer, high-density polymer, one is hydrophilic, one is hydrophobic, and what it does is it creates 2 phases where these small biomolecules are inadmissible and get pushed to the bottom. So this process is you're going to do this first spin as normal to separate your RBCs from your whole plasma. Then you do your second spin to create your PRP. So that leads to there being PPP, and that's usually where these other PRP systems stop. They do 2 spins and that's it. But with SuperShot, you're going to supercharge your PRP. So you're going to take your centrifugation solution, mix it 1 to 10 with your PPP, and spin it for 1 minute. And that's gonna pellet all these autologous exosomes down to the bottom. You then remove your solution, and when you do that, you're removing the centrifugation solution with the depleted PPP. You then resuspend the exosomes in your PRP, so then you have your SuperShot PRP, which is concentrated platelets and concentrated exosomes. So as I mentioned, the SuperShot solution is discarded, and we've sent samples to an outside lab. We used high pressure liquid chromatography and size exclusion chromatography to measure if there's any PEG or DEX left in the injectate. And what we found is the PEG is in the micrograms per milliliter range, and the dextran is undetectable. So why are these exosomes important? So you can think of them as like cell communication packets. It's how a cell talks to another cell. And the important message they have inside is this microRNA. So the microRNA has the ability to regulate gene expression in the recipient cell, so it can affect pathways for angiogenesis, cell proliferation, inflammation, all these things that are involved in a PRP procedure. We've also tested the average concentration of exosomes you get per process using a nanosite machine. So a nanosite is a device that uses microfluidics and a laser. It doesn't just measure the concentration, it measures the diameter of every particle. So we know that these exosomes are around the 100 to 130 nanometer range, and so that's why we see this nice peak there. And on average, you're getting 100 to 200 million exosomes per cc of PPP. And we've also done these microRNA panels, and what we find is an upregulation of microRNAs for SuperShot PRP versus standard PRP. So I think it's worth mentioning that there are other exosome products, but these products are not equal because they're allogeneic. So that means the source is donor, so there's some health risks there. The production requires processes like lyophilization, which can be extremely damaging to biological material. And because of FDA guidelines, these types of exosomes can't be injected. But with an autologous product, the source is your patient, so there's no risk of outside disease. It's done at point of care, and because it comes from the blood, the FDA guidelines see it as not a drug, and so they can be injected. So we compared what you would get with SuperShot with a leading allogeneic product, and what we found is the allogeneic product, you're only getting like 0.6% of what you can capture with SuperShot. And because of this two-phase aqueous system, it's a very efficient way to capture small molecules. You're not just getting exosomes, so you're also getting A2M, which is a great protease inhibitor of these enzymes that break down cartilage. And we did, actually Dr. DeWalt did this study for us, versus hemoconcentrating filter, and we found that you can get 140% more A2M for SuperShot processing versus the filter, and then we found that you're getting 4 times more exosomes as well. So I think the most convincing thing is the data. So our chief medical officer uses the data collection platform, Data Biologics, and what he's seeing in his clinic is this nice downward trend of numeric pain. These are these are shoulders, so you see decrease in the quick dash scores. These are knees, and so you see the decrease in numeric pain again on the left, and improvements in Cruz Jr. scores. So SuperShot can also be paired with bone marrow. So this again is shoulders, so same trend, reduced pain scores, reduced quick dash scores, and this is bone marrow with knees, again, reduced pain scores and improvements in Cruz Jr. scores. So what we have coming up is our CMO, Dr. Nabdi, will be giving a talk at Toby IOF. It's some pretty compelling data that goes out to 2 years, and it's multi-center, and it's comparing SuperShot versus standard PRP. So if any of you are planning to attend, we'd love to see you there. And just the recap, so SuperShot is the only 3-spin process for PRP that allows you to isolate this autologous exosome fraction from your PPP. Spin time is just 1 minute. It uses a 2-phase aqueous system. You're getting hundreds of billions of exosomes added back to your PRP injectate. It efficiently concentrates A2M as well, and you can use it anywhere your standard PRP is being used.